Welcome to another episode of Sisterhood with Scalpel. I'm Dr. Maryam Zamani.
And I'm Dr. Julie Khanna.
And today we just want to take a moment to talk about liposuction and dispel this myth that all liposuction is the same, because it absolutely is not.
Even when we teach it to residents and we teach it to students, it has changed. And it surprises me how many people, unfortunately, haven't embraced that change, because technology has changed lipo for the better. It used to be kind of this, people would say, oh, just suck it out. Like, don't watch the YouTube videos. But now it's finesse, isn't it, Dr. Z?
Absolutely. So it's not just the technology, but it's also the techniques that we've developed so that everything just comes out to an upper echelon. It's not just, like you said, sucking out fat. That's not the purpose anymore. Liposuction has never been about just taking fat away. So it's not a weight loss tool. And that's one of the most important things that we always stress to everyone who comes through looking about more information about liposuction. But rather what it is a tool that we can use to help you achieve a better shape to your body. So we can help contour and then what we like to call change your silhouette or your physique.
Well, silhouette, think about it. We get square, pregnancy, weight gain, things like that. If you just debulk or do what people call traditional lipo, you're going to have your same shape, just smaller. But what we do here at ICLS, Dr. Zamani and I, we go, no. You want more waist. Oh, you got the badoom in the hip rolls and the hip bumps. We can improve that. So we look at all of it and we look at 360. That's a different thing. We look front to back when we talk about lipo. And so many people don't do that. And I don't know why.
Well, it's funny, like you say, because we're not, people are not pictures. We're not two-dimensional. We're three-dimensional. It's all about how you feel in your clothing or outside of clothing. And you don't just do that standing in front of a mirror or facing everyone either, just straight on or just on the side. It's about how you move and how you feel and just doing different activities. So that's why it's really important to always make sure that when you're going in for an evaluation for liposuction, that your surgeon is taking the time to make sure we're evaluating you 360 and really addressing your concerns. And we were alluding to shape earlier. And there's also different preferences for shape. A lot of times women come in wanting to accentuate their curves, but we also have this big trend towards more fitness, more muscle definition, more of just making a more athletic look. And that's also something that we can accommodate. So that's also when you're coming in for a liposuction consultation, bring us some photos. Let us understand what it is that you're exactly trying to achieve, because we can tailor make a solution for you. And that's really important.
So if you look at our liposuction and what's different from everyone else, I'm going to start. There's three things that I think are different. First of all, we look at maybe four. We look at the 360. Number one. Number two, we only use VASER. VASER is ultrasound lipo. So traditional lipo, when you take out fat, you create new skin. And traditional lipo will tighten skin about 5%. Ultrasound lipo does two things. One, it gently releases fat, and it tightens skin about 18%, so way better. Then we're looking at not only removing fat, but it sounds crazy, we put in touches of fat grafting as part of our 360 lipo. Not to make you look like Kim Kardashian, but just to smooth out the bumps. And then the last thing is we offer radio frequency, which takes skin tightening to the best level we've got. Nothing is 100%, but about 33% skin tightening when we need it. So we can get max tightening, max shape, max contour softening when we're doing it the way we do it. And that's routine for us to look at that.
Absolutely. And the important thing is when we're describing all of this, sometimes it starts to sound scary because you're like, oh, you're doing so much surgery. But it's important to know we're doing it all through these small, less than 1 centimeter large scars. That's the same scars that we use actual active liposuction. So when we're using the ultrasound device, when we're doing the suctioning and when we're doing the skin tightening, they're all little pencil-like devices that go underneath the skin through these very tiny holes to achieve the effects that we want. We're doing lots of surgery, lots of finesse surgery, but the scars are much smaller. And it's really important to know that this combination of energy builds upon itself. And there really isn't anything else out there that can achieve the same thing. So a lot of times people will ask about, non-surgical options that can help reduce the fat or that can define the muscle a little bit better. There's certainly a lot of technologies out there. We certainly offer a lot here at our clinic as well at ICLS, but it's important to know that none of these are on par with what we do surgically. And typically they can't achieve the skin tightening that we are offering, that we're able to achieve with that. Now, again, that's not to say that when we do this type of skin tightening, it takes away all the extra loose skin. Sometimes the answer is still to take away the loose skin surgically, but it's really important to have that in the back of our mind to know that there are other options that didn't used to exist that many years ago.
And we do that, right? If you come in to talk about a tummy tuck, we give you the option. We look at you. We don't say, we don't pigeonhole you. If you come to talk about lipo, we're going to be honest with you. We're going to look at you 360 pros and cons. This is a discussion. It's teamwork. So we're looking together to make the right choices for you. I think the other thing that we always have to say is, you know what? Get information. And as Dr. Zamani said, one thing isn't right for everyone, and you have to pick and choose what's right for you at that moment in time. The other thing that we do is our big lipo cases, everyone's afraid of lipo. We keep you overnight. We have 2-bedroom suites. I just saw the patient from yesterday. She's walking around. She looks amazing. And, she was walking laps in the office last night with the nursing staff. And she feels really great and confident because we took care of her. We like that. Our patients like it. And it's kind of like another added thing when we're doing those bigger lipo cases so you don't feel scared and alone.
Well, on the other end of the spectrum, we also sometimes do very targeted, smaller scale liposuction. So, for example, one of my favorites right now that really delivers great results is arm liposuction. So the upper arm area. And as opposed to our bigger liposuctions where we do put you to sleep, where you do stay overnight, this is a procedure that most commonly we're doing with just local freezing and laughing gas. And patients are always surprised at how great it is, how comfortable they're able to feel. And they actually help us because they're moving around. We get to see how their muscles move, how their skin moves. And then, we're chit-chatting away. We're bonding even more with our patients during the surgery as this is happening. And the recovery is easy. You get to go home the same day. And that's what it is. And this is a great time for us, whenever patients are kind of free with their schedule and considering, well, what's a good time to consider liposuction? Really, any time's a good time to consider liposuction. But one of the things that we ask of our patients to do afterwards so that it really helps optimize the results and also speed up the recovery is to be in compression garments. And that goes on for about 6 weeks. So, as the weather is getting a little bit chillier, maybe not this week, but as we're trending towards chillier weather, that's definitely something that, you're layering up anyways. So this is just one more added layer and a great thing to consider for fall and winter.
And I'm going to add one more thing is you really do have, Dr. Zamani and I just wrote a chapter in a liposuction textbook on arm lipo and using technology. So this is something really that we offer our patients that is cutting edge. So we're really excited to see you for a consult. We're happy to discuss the options for you. And if there's any questions, shoot us a DM, shoot us a message on YouTube. What do I say to do that? I don't even know. I'm so old. You say
to make sure that you're following us and getting the best content, the most up-to-date information that we're able to provide you. Make sure that you subscribe to our YouTube channel and also follow us on Instagram. Again, if you have any questions, reach out to us. We're always happy to see you in person, or even if you have questions that you want us to address on these kinds of video formats, we'd love to hear from you.
I'm Dr. Julie Khanna.
And I'm Dr. Maryam Zamani, and it's been such a pleasure giving you this information segment today.
See you next time on Sisterhood of the Scalpel.